Executive Director, Health Emergency Initiative, Paschal Achunine, joins me via Zoom to discuss this. Good to have you join us.
Good afternoon. Thank you for having me.
I think it was 9 months ago where the first announcement was made that the vaccine or the possibility of the vaccine being rolled out in a few months' time was high. And now the announcement has now been made that the vaccine will soon be rolled out. But the main financial backer, which is the Bill and Melinda Gates Foundation, have now pulled out, saying they have concerns because the vaccine is just about, I think, 30% effective. They wanted to speak to that, if their concerns should be taken into account.
It should have been a cheering news to hear that there's a vaccine to the issues around malaria. Malaria remains a major issue in Africa. In 2020, for instance, 620,000 people died. Nigeria alone recorded 27% of those deaths, and they are mainly children of 0 to 5. So it's something that concerted effort, collaborative effort, and consistent effort should be expected from all stakeholders, not just Bill and Melinda Gates Foundation. But we are concerned, and it may not have been out there clearly, but it appears that perhaps the sort of support, cooperation from government, because if you go back to countries like El Salvador and other countries that were certified malaria-free, there was consistent deployment of resources annually to eradicate malaria. In Africa, most African countries where it's still endemic, that is not happening. So perhaps that is some of the conjectures people are having, that it could be the reason why they are pulling back. And as it were, it's only 3 African countries, Kenya, Malawi, and Ghana, that will be recipients of this vaccine. And the very fact that it's only 30% efficacy also cast doubts about whether it will really make the phenomena change. But the good thing about vaccines historically is that this is if this is successfully deployed, people can build, other institutions and stakeholders can build on that. It's possible that the organization could come back to support it in the future. It's possible that other researches, it may take a longer time, that could ensure mass production might happen in the coming years. But it's being received with mixed feeling. It's being received with some sort of concern that if you back this for this number of years and at the point of deployment you're pulling out, how do we ensure sustainability?
I think the Bill and Melinda Gates Foundation have deployed about $200 million so far. That's so much at this point. They are pulling out, and they say that they are really worried about that 30% efficacy rate. It's going to be deployed in Ghana, Malawi as well. How should African countries receive this vaccine, and Kenya, you're right, receive this vaccine because of the efficacy rate? And then people are also talking about adopting multiple strategies. How should we receive it?
I think it should be a multifaceted approach. One is in the thinking of Bill and Melinda Gates Foundation, they consider that deployment of $200 million and at the end 5 million vaccines should be rolled out annually, and that would only generate 30% efficacy rate. That funds can be deployed to other areas of either fighting malaria or other areas of needs in the health space. But I also think that this is just one approach in dealing with the issue of malaria. Countries that achieved significant reduction in death rates, countries that achieved malaria-free status from WHO, they took indigenous or homegrown solutions to address that. So the vaccine is welcome, but there are some other initiatives which there could be comparative analysis, comparative study around how did El Salvador, a country as small, it's not one of the leading countries in the world in terms of its economic capacity, but it was able to achieve that in 2017. Algeria, many other countries did. So for other countries where this is endemic, let's even isolate vaccine. Vaccine is recommended though, but if you isolate vaccine, what can we do to reduce death rate? What can we do to improve the environment? What resource allocation initiative should these countries embark on to improve the fight against malaria? It means that it has worked. If you have worked for some countries between 2000 and 2017, over 13 countries we are certified malaria free. So it means other countries that are still struggling or are still recording high rates of deaths from malaria could deploy these similar steps. And I just want to mention one of the key threats, malaria. Let me give an example. This week, I got treated for malaria. And I mean, the lab results showed that I had 2+ in medical terms. So what it means is that for 2 days, besides the treatment I had over the weekend, the first 2 working days of this week, I was not at work. Malaria affects productivity. If we put it in critical terms, what the economic impact of malaria besides the death?
Absolutely. Absolutely. I don't think that I've seen anyone who is treating malaria that is able to manage and stay at work as well. A lot of people have to stay off, even just for the treatment to be effective in itself. But you mentioned homegrown solutions, and that has been, we've been talking about that since the COVID-19 pandemic, that Africa needs to find solutions to its own problem, especially health problems that are endemic in Africa. What sort of solutions should we be looking at, especially for a place like Nigeria where malaria is also endemic?
So the primary vector or trigger of malaria is mosquito. So the environment is, dealing with the environment is critical. Effectively, not just the rhetorics, is most of the things we do in all those programs are rhetoric. Effectively ensuring that access to mosquito net is in place is another important step. Of course, before we now get to the very sophisticated level of complete eradication, if we deploy also mechanism to measure. Okay, if we have ensured improved sanitation, improved environment, in 3 months, this is the mileage covered. If more members of the population have access to treated mosquito nets, this is through M&E mechanisms, this is what has been achieved. Then we could now bring in other sophisticated measures these are all homegrown, like I said, including access to timely, like there's access to mass testing, mass treatment. Those are also important measures. And of course, we can't run away, we can't sidestep the primary healthcare system being effective. Once the primary healthcare system is working well, it is the bottom line. It's the catalyst that will make malaria eradication a
Absolutely. No matter what we do, without a functional health system, it just all amounts to nothing. But we'll continue to watch how this plays out in Ghana, Kenya, Malawi in the coming months. Thank you so much for talking to us. Executive Director, Health Emergency Initiative, Paschal Achunine.
Thank you so much.